Okay, okay, Arif.
Okay. If anyone just trying to admit in this session, please do the admission.
Arif, what
Yes,
about
sir.
Indranil Datta?
Sir,
From
Indranath, I tried several times in the previous session to talk with Indranil Datta. Sir,
Now he is
maybe
here.
he is from Kolkata, sir. Indranil,
He's
sir,
here.
if you are online, we want to hear you from your place.
Dr.
And,
Arif, we are live on YouTube. We're going to start.
yes, sir. With the permission of Bari, sir, I want to start the session. And a special thank to Samsuluddha sir and Ortho TV authority for doing this type of session live. And this is also a Indo-Bangladesh good friendship collaboration sign. Every time both the friendly country are working together for science and research and education. And you know that today is a very big day for the Kurgan Fellow Group, because our mentor, our professor Mufakkar Bari will present the basics of biomechanics in Ilizarov fixation. And everybody everybody know the Bari sir. There is nothing to be introduced more, but as it is a formal session, so I want to just repeat the few things. And Bari sir done his PhD from Tashkent, MS, MD from the Kiev, and he is the honored professor of RISC RTO, Kurgan, Russia, Ilizarov Center. And he also the honored professor in the Weifeng University, China, and he is the chief consultant of Bari Ilizarov Center, which is a very renowned Ilizarov Center in this subcontinent. And now I request our Professor Bari sir, please share your screen and have your presentation. Bari sir.
Okay, okay. Visible?
Yes, sir.
Okay, can I start?
Yes, sir, you can start now.
Assalamu alaikum. Good afternoon, everyone. And good morning for the Nigerians. Today, I'll talk on the Ilizarov compression distraction device. Russians, they always tell this, the compression distraction device. And we are telling these external fixators. There are more than renowned 50 external fixators. But the Ilizarov compression distraction device, this is basically quite different with other external devices. And today I'm going to talk on the biomechanics of the Ilizarov compression distraction device. See, young Professor Ilizarov, here is written in Russian language. It means in English, directing the force of the nature. Направляя силу природы. So Professor Ilizarov, you see here, young chap, he is just doing his scientific work, the biomechanics of the ring fixator. And what is biomechanics? This is the study of the structure, function, and motion of the mechanical aspects of biological systems at any level, from whole organisms to organs, cells, and cell organelles, using the methods of mechanics. Biomechanics is a branch of biophysics. So Ilizarov fixator is always related with the biophysics. Look at this. I'd like to share something regarding the activities of the Professor Ilizarov. If you look at the right side, see this one. Apparatus named after Ilizarov. This is written here in Russian language. And this is in 1952, 9th June, the Ministry of the then Soviet Union, Union of Soviet Socialist Republic, his patent given the certificate. This is, you see here, Professor Ilizarov, Professor Shevtsov beside his, and here is written here, Priznanie metoda Ilizarova, that means recognition of the method of Ilizarov. recognition of the method of Ilizarov here. And I must say you here, the apparatus which was named after the name of Ilizarov, it was in 1952. And author's certificate that I showed you, this one, yes, ministry has given is the certificate, Gabriel Abramovich Ilizarov. And in 1971, dear friends, he started working in 51 and 1971. After 20 years, there was a very big symposium in Kurgan, which was guided by the St. Petersburg Scientific Institute here. And Professor Ilizarov delivered 1 hour 50 minutes there, and he showed 700 cases. The hall was packed with the orthopedic surgeons, and you know the Olympic champion Brummel was present there in 1971. He was treated by Gabriel Abramovich Ilizarov. So here, this is the, there is a small book, and he has written everything here. And then they have taken the decision that they will go for a construction of the new building, and 1971, that building was started, new building here. Before that, Professor Ilizarov was supposed to consult all the patients in the Corpus building number 2, where is the museum and osteomyelitis center is situated. So this is in a nutshell. When he started talking, Professor Ilizarov, everybody was curious, and every orthopedic surgeon, it took it just a contagious, you know, and without proper training, most of the orthopedic surgeons started doing this Ilizarov technique at that time. And what happened at that time, and it mislead blame regarding the Ilizarov external fixator. At that time, Professor Ilizarov said, boldness should not exceed one's skill. Before doing any Ilizarov surgery, you must learn the biomechanics, principles, philosophy, and regarding the apparatus. And fortunately, today in the world, you know, most of the Ilizarov surgeons, they have, after doing this, knowing the Ilizarov apparatus, nicely, carefully, they studied the method and became the world-renowned, famous expert. And you know, those who are doing Ilizarov in different countries, they are now well-known because of this Ilizarov technique. So next slide, dear friends. This is, I already love to show this one. This is center again. I will proceed. This is, I love to see this one also. These are all faculties, our institute. This is my center. This is, I am in Kurgan center. And now, what is the Ilizarov fixator? If you understand the biomechanics of the Ilizarov fixator, there is nothing to be worried. This is Ilizarov fixator. Classically, if we talk about the regular fixator, this circumferential, you know that one. We are using only the small wires, 1.5, 1.8, and 2 mm wires. And these wires are smooth. And the wires that we are using, we must apply tension. And now, in some cases, we are using the hybrid also. In the Western world, they are using hybrid most of the time. So what is optimal stability? Look at this. This picture I have shown you earlier in my lecture of the history of the Ilizarov. Horse in harness with a shaft bow, decorated, each standing behind the horse's head. You see, when horse running like this, if the frame and this one is cart is not stable, you cannot move, horse cannot move. So Ilizarov, on the basis of that, Professor Ilizarov invented this Ilizarov fixator and biomechanics of the fixator. What is optimal stability? How can you ensure? Look at this boy with Ilizarov fixator. If you put a lot of rings and a lot of wires, it doesn't mean that you have fixed stable. You have done the stable fixation. And here, see the ring, the wires, and You must apply the tension, and you're getting the stability of the optimal stability of any fixator. Now, in Ilizarov fixator, there are three basic biomechanical modes to Ilizarov external fixator. You know that compression, distraction, and you can go for neutralization also. I told you earlier, the Russians, they love to tell all the time the compression distraction apparatus of Ilizarov. So look at this, the compression mode is used for joint arthrodesis. Here you can see compression mode, fixing this two arrow is from this downwards going, this is upwards. The compression mode is used for joint arthrodesis or simple fractures to impart stability to bone ends. The distraction mode is used for osteogenesis or calotesis, for limb lengthening, as well as for ligamentotexis to provide stability to intra-articular fragments. And in case of neutralization, if the fracture is highly comminuted, then a neutralization mode is used to prevent limb shortening at the fracture site. Now, all of you know regarding the, whenever you're talking regarding the external fixator, you have a monolateral external fixator, bilateral external fixator, and circular or ring fixator, that is Ilizarov. Monolateral constructs only the half pins are used in a cantilever mode. You know that cantilever. Bilateral constructs combination of half pins and the fixator wires are used. And Ilizarov circular, we are using all the time the wires, and sometimes depending on the location of the anatomy, we are using also pins. So this is circular constructs. And what is optimal stability? See, AO groups, day before yesterday or yesterday I told, stability, when you are getting stability with the Ilizarov fixator, you are not getting rigidity. Rigidity is not the stability. Stability is not the rigidity. Rigidity means you are getting undesirable stability. These are the important things. This is applicable for uniaxial fixator. See here. And desirable stability, when you are getting stability that is needed for you, you can control yourself, and at the same time you are getting axial micromotion. In Ilizarov fixator, I will tell you later on, not less than 1 millimeter micromotion you are getting. And regarding the undesirable stability, you are getting angular bending. If your stability is undesirable, then you are getting angular bending. You are getting shearing movement, that means side to side movement of the two fragments, and you are getting torsional movement, that means rotational movements of the fragments. That is the undesirable stability. And in Ilizarov fixator, we don't need that one, undesirable stability. See stability spectrum, if you think about that, think about the unstable fixation and primary union, unstable and primary. Primary union, you can get it through the internal fixation also. Our target is to go for the secondary union, not for the primary union. These are the, if your fixation is unstable, you're inviting all these problems here. Hypertrophic, non-union, loosening of the fixation, stable fixation you are not getting. So look, here you can see the dear friends, regarding the stability of the uniaxial fixator. Your fixator is from the lateral side here. What you are getting here, when you apply the force, this is one fragment, this is one fragment, you are getting bending force here because from your cantilever, one side you are holding this from the lateral side. If you come from this side, this is also getting your a little bit bending force, but you are not getting more stability. This is your axial view. And look at this, stability plane of fixator. What is cantilever? Cantilever loading here, you can see, dear friends. If you can see, a cantilever structure is one which is supported only one end. And this is cantilever fixator, uniaxial. But beam loading. A beam loaded structure is supported at both ends. Here you can see here supported by both ends. And here you are getting what you are doing. Shearing is side to side movement is minimal. Axial movements you are getting here with bending. But if your uniaxial fixator, if you draw these lines, come here, cross this bone, then what you are getting bilateral fixator. And this bilateral fixator, your movements will be minimized and axial movements will be minimized. So if your fixator is like this, 90 degree to fixator plane, here you can see here, you are getting bending moments, and this is much less. But shearing, some shearing movement here you will get, and axial movement is very negligible. If you fixator light in this way, same thing you are getting. Now, biaxial two frame from this side, if your fixator is from this side, and from this side, you are getting delta frame stability. That is two uniplanar fixator, one this direction, another this direction. What is happening at this? Axial movement is prevented here. This is very important. These are the biomechanics of the biaxial fixator. And this fixator gives you always the stiffness of the fixator. And you are inviting all the time non-union. And this is called the non-union machine also. If you think about the, you know, most of the orthopedists have, they know orthofix. This is if you want to use uniplanar fixator orthofix, you can see this is axially unstable by design. And you can control yourself. It can go up and down, stable to bending, rotation, and shearing, but uniaxial, not like the Ilizarov fixator. Now, dear friends, very important thing I'd like to draw your attention regarding this. You see, linear versus non-linear stiffness. This is totally related with the biomechanics of the Ilizarov fixator. What is happening here? You can see, this is, if you think about this is the load and this is the displacement. In Ilizarov fixator, what is happening? When you are allowing movement, if you take more and more movement or weight, if you allow weight and then movement, you will get initially displacement of the fixator. Initially, you'll get it, and ultimately, it goes to some plateau, some level, then it stops. This is the Ilizarov. If you compare with the not Ilizarov, other uniaxial or non-circular fixator, you are inviting all the time displacement, which is increases in a linear fashion. This is the difference between the Ilizarov and other fixator, or semicircular, just like Volkov Oganessian fixator, or any other uniaxial fixator. Regarding this, now, this is very important for everyone. Why Ilizarov is stable than other all fixators? Look at this, the diagram, the right side and to the left side. If you put Ilizarov, what is happening? This is a I-beam system, means you have got the 4 points fixation. You are getting all the time, this is your bone, 4 points fixation, here, 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 and here. And every, you see, in every area. This is circumferential. I can hold from all sides, and it can goes up and go down. Regarding the axial stability, if you press this little axial, one less than 1 mm, and allows better axial micromotion here. And what are the other stability? See, the bending stability, torsional, that is rotational. Bending is equal or more, torsional, equal or more, shearing stability, equal or more. Biomechanically, definitely superior than other fixators. This is the beauty of Ilizarov. Why Ilizarov more stable? These are the very important I-beam fixation, 4 points. I repeat it again. Now see there, what is the axial micromotion? Probably less than 1 mm displacement at maximum load. Whenever you apply load and load in the Ilizarov fixator, that's why fundamental principle of Ilizarov methodology is load and motion. Whenever you are giving load, you are getting good excellence osteogenic response in case of Ilizarov fixator, because it is a transosseous fixator. You are using the small weights, and if you go for the macro motion. More than that, you are not getting good response of osteogenic response. You are not getting that. So now, Ilizarov compression destruction device, these are the very important variables you can see for stability. Wires you can use, you must think about the diameter, proper tensioning, drop wires also 1.5, 1.8. 2 in my country I'm using, I'm getting it from Russia. And you should think about this ring size, type, offsets of the bone, and connections, how many rods you are going to, and the position of the rods. And of course, the quality of the bone, span of the bone health, fracture geometry, and interfragmentary compression. These are the things that you should have to think before applying the Ilizarov fixator. Advantages of the fixator is that, can I hold Professor Shepsov? Hello.
Yes, sir.
Vladimir Ivанович, я выступаю сейчас, Владимир Иванович, извините. Я потом буду позвонить вам. Хорошо? Хорошо, я в бинаре. Okay. Then advantages of Ilizarov fixation were great advantage to a beam loaded with tension wires, where implant is the adjustability of wire tension to customize the strength of the implant. Varying amounts of tension can be used to support different loads in different parts of the bone. Now, dear friends, you see here, Ilizarov wire tensioning. Why? If you give the load, I'd like to tell you something regarding the tensioning of the Ilizarov. Look at this. If you, as for example, if you use 1.8 mm wire, 150 kg, 150 mm ring, and starting from 80 to 130, if you apply tension, how much stiffness you are getting. Elasticity of the wire is really due to decreased stiffness of thin wires. 1.5, 1.8, and 2 mm optimizes low stiffness property. This is very important, the properties of the wires. And this 1.5, 1.8, and 2 mm property millimeter wires maintains sufficient strength to resist breakage of the plastic deformation that you call ductility, plastic deformation. And very important thing is that here you can see elastic deformation, plastic deformation, and yield point. Look at this. Yield point, that means ultimate point. What is that? I'm going to tell you later on. When you exceed the yield point, the wire will break. Look at this safe limit, 50%, 100 to 150 kg. This is your load you're applying. This is the length. Now look at this. If your wire is 1.5 mm, area you're capturing 1.76, and you are applying load to 12 kg. If your wire is 1.8, then you are applying 3.5 kg. If your wire is 2 mm, you are getting this. Now, regarding the yield point, the point at which the wire is plastically deformed in tension is called the yield point. This is the yield point. Understand?
Yes,
Yield
sir.
point. What is ultimate yield point? The point at which it breaks. This is called ultimate yield point. When it breaks, ultimate yield point. Or you can tell it ultimate tensile strength. Yield point to be 120 kg per square millimeter. That is 210 kg or for 1.5 mm wire, and 305 kg for 1.8 mm wire, and 340 for 2 mm wire. Professor Ilizarov, before invention of the dynamometer, he was using the manual tensioner, manual or Russian technique. For fracture and non-unions, he always used 80 kg to 90 kg before the invention of dynamometer, which was, he applied always 80 to 90 kg. After the Professor Ilizarov, then when dynamometer was invented, then 120, even 130 kg. They have a marking. You have seen dynamometer that was made from Kurgan was 130 kg. And I myself, the experience and what I am doing, if I see this is very important, your ring is full ring, you can use 130 maximum. Or if you're using half ring, that will you'll get 90 kg weight. Half ring for 90, for full ring 130 kg. Increased tension is very important. Provides increased stability for increasing the wire stiffness. It also decreases the axial excursion of the wires on loading. So this is very important. Another important thing is that if a fracture situation, no additional is to be applied to the wires except for weight bearing for fracture case, fresh cases. A limb lengthening, you are adding tension applied. That's why for limb lengthening, 80, 90 kg tension, you can apply, no problem for that. So this is regarding the loading, plastic deformation, heel point, that probably I told everything. Now, regarding the manual tensioning, if you're expert enough, Russians, they are routinely doing without a dynamometer. They have a good strength. If you're using slotted, and if you know the technique, this is also good. But in other Russians, they're trained up. They have developed all these things. Rotations in degrees, if you are using the cannulated, or if you're slotted, then quite different. See the difference between manual and slot, manual tensioning in case of slotted and cannulated. So carry home message for tensioning. Tension wire stability, 90 to 130 kg with a dynamic tensioner or dynamometer. How it can be applied? See, here is a marking here for the young newcomers, those who are learning for the Ilizarov. See, this is how to apply the dynamometer. This is the jaw. But here is the tension. Everything is written. When you are moving your dynamometer, you'll see how much weight you are applying. And striving force around the ring must be equal. That is good. That is always good. Now, stability. This is very important. This is totally related to the biomechanics of the Ilizarov fixator, because you are using the always the wires. See, tension wires. Crossing angle, you must. Professor Shevtsov Vladimir Ivanovich told me, first time when I met him, he told me, you can put 10 degree to 90 degree, minimum 10 and maximum 90. But 90, you cannot put everywhere all the time. Lower 1/3 of the tibia, you can go for 90, cross angles. But you can go for this 10 to 90. But range is 30, 35, 65 is good. You can do easily this. Increased stability with increased crossing angle. This is the theory. And bending shear stability increases along the bisector, decreases perpendicular to it. Look at this. If you put like this, it's very good, but not all the time. This in practical life, you cannot do this. You can do this. Here 45, you can do 35. This is your 180 degree angle. This is 180 degree. This is 180 degree angle. Here you can calculate this is 45. 45 plus this 180 degree angle. Are you off-centered? This is also a problem. This is good. Off-centered is the problem. You can see here the tested configuration of the Ilizarov. This one, this one, this one. And we are using all the time this. And I told you from 10 to 90, you can apply. Nothing to be worried for that. And drop wire, see. Drop wire, you know, the wire away from the ring. Whenever you're putting the drop wire, see here the stopper, rubber stopper, Y-shaped cutting. This is for the, if you don't forget, before applying, you just put the rubber stopper like this with the Y-shaped. This is for olive, or smooth for smooth wires. No cutting, smooth wires. So if you don't forget, when you are going to dismount your apparatus, if your rubber stopper is cut, Y-shape cut, you will be able to understand this is my olive. From which direction you should remove, you can easily understand. So increase in bending stability, proportional to distance from the ring. This is a, see, look at this olive wire, how to correct the medial malleolus fracture, bimalleolar fracture with your olive, drop wire with post, four hole post, and with one ring here and half ring here. Easily, these are the stages of surgery and the drop wire and the olive wire to put and how to put. If you do all the time, you'll be able to understand the utility of the drop wire and the olive wires. Transosseous olive wires are used to achieving interfragmentary compression, which incorporate a bit used to contract and control bone segment. See here, this is a good correction you can do. You will in your life you'll see transosseous olive wires, and this is 45-degree angle, and this is from side to side, greater than 60, less than 30-degree. So oblique fracture here. And now the same type of interfragmentary compression can be achieved using the thin tension wires called bent or arched wires. How you can correct arched wires? See here. By inserting a transosseous wire straight and then bending the wire to form an arch before applying tension, the wire can provide a directional force across a fracture or joint in a direction towards the concave side of the arch. See here, how can you arch wire technique for interfragmentary compression. Half pins I told you with Ilizarov external fixator combinations, the combination of the half pins and wires. This is the wires. See, this is your whole femur. This is your non-union side. You can put shunts here. This even in the center, the wire is properly tensioned. You can see one olive and one wire. Half pin and thin wire in the Ilizarov external fixator useful when wide crossing angles cannot be achieved due to anatomical constraint, as for example in upper thigh. Here you can do that one. See, placement of the shunts and half pins and the wires. Okay, and hybrid Ilizarov fixator that used both transosseous wires and half pins could still achieve a self-stiffening effect. This is very important. Common to pure transosseous wire Ilizarov fixator, as long as at least one bone segment on either side of the fracture contained all wires. However, when wires and half pins were mixed on all Ilizarov ring levels, the self-stiffening effect is lost. This is the inadequacy of the shunt pins. Now, shunt fixation. This is very important, dear friends. If you want to use the shunt pins, please go for the pre-drilling first. Necessary for prevention of the thermal necrosis and long-term retentioning and loosening. Increased diameter. That means you should think about the geometric increase you're increasing. You can use 4.5, 5.5, 6 mm piece. And biomechanically, hybrid frame is less stable biomechanically, because here I told you I-beam, which is applicable in case of Ilizarov, I-beam functioning is lost in biomechanically hybrid frame. This is less stable, but functioning you are getting regenerate bone. But in comparison with Ilizarov, only the wires, Ilizarov fixation is of course the stable. Now, half pin should not be placed too close to the joint capsule or fracture hematoma. Wires or half pins further apart at each ring level will increase the leverage of Ilizarov external fixator. Now, if you ever think about the bone factors, if your bone is osteoporotic, thermal necrosis, loss, you are getting loss of tension. See here, 3 figures I have shown you. Bending, shearing, stability, advice is possible. If you are using this is your bone. If you're using one ring, one drop wire, and another drop wire, what do you think about the stability of the fixator? If you're using one ring, here only one ring, one drop wire, one drop wire. Here one ring, here one ring, one drop, this ring and drop wire. Two rings, two drop wires. Here one ring and two drop wires. Which will be more stable? If you compare, it cannot be. One ring, two drop wires, you are not getting good stability of the fixator. You are getting, if you apply this, you are getting a little bit good stability. But this is also not good. One ring, one drop wire, one drop wire. So these are the things that you should have to keep it in your mind all the time regarding the biomechanics of the Ilizarov fixator. Now, a good planning for operation theater, I must tell something which is related to the biomechanics. A good planning, this is from my center. These are all what I'm showing you from my center. A good planning can improve the efficacy of Ilizarov application in the OT. Even surgeons should have a preliminary idea of the type and design of Ilizarov fixator needed for the surgical procedure. You can take a template or a paper like this hard, and you could count yourself like this. Pre-operative ring sizing of the lower extremity indicates which rings to be applicable in OT. If you're expert, by looking your eyes, you can easily guess that this leg or this thigh or this arm, I can apply this kind of apparatus. If you're less expert, then you do it. Then within a short time, you'll gather knowledge and you'll be able to calculate which kind of ring you are going to use for your patient. So this is also from my center. Position of the patient. See, look at this in a ring and in the lower extremity, an image intensifier. It will be the right side. And these are the frequently used. Don't keep one or two things. Lot of things you needed for this. See, everything. These are the available dynamometer, wire cutter, rings, individual blocks, rubber stopper, half pins, everything you must keep like this so that you can use very easily. These telescopic rods, these are different size of the bars, then you can use. This is also leg stand for C. This is operating room table, which accommodates all necessary trays for Ilizarov application. These are the sequentially, if you select all these things, you will be able to do any kind of Ilizarov surgery. So, dear friends, look at this. This is for my foreign Nigerian friends and our junior friends. So look at this. These are the bows. This is oblique support, telescopy, different sizes of the rods, and this is for mini Ilizarov fixator. You can use in the short bones, metacarpal, metatarsal bones, wire fixation tray. This you can put your different sizes. These are the balls, and this is half pins, cubic, and different varieties of washers and rubber stopper, of course. Put everything so that easily you can get it. And this is your K wire, Ilizarov wire. You can put inside small component trays. A lot of things are needed. Once you collect everything, then day by day you can gather a lot of things here. So, see, cut for this rubber stopper. This is olive. Here is the Y-shaped cutting, so that you can identify this is my olive, and these are the smooth wires. So wire cutter, these are the things. If half pins are applied, these are half pins. See, a separate tray with half pins or insertion tools and pin cutter is used. This is your pin cutter. These are all available in my country. You can get easily, but half pins, these are all from my Kurgan. So there are varieties of half pins. Their half pins are very good. So this is, you see, dear friend, this is a diabetic foot. I'm showing you just one thing. I have done this arthrodesis, the diabetic foot. It was probably, planned for delayed closure. Sometimes you go for a mini incision and then you can fix it. I've done arthrodesis of this case. And see, this is a case. Ilizarov can be fixed in the plastic surgery department. This is it from Kurgan when I was there. I was in the plastic department, hand and plastic. See how they're fixing at the same time the all kinds of plastics. And look at these, and this is not that you have done, you have applied the plaster, no. Stable fixation, biomechanics. See biomechanics here in the how to put all the wires in the toes. So see, this is also application of Ilizarov. Rehabilitation activities. Yesterday, our Munir fantastically showed everything regarding the rehabilitation activities. And I give always good emphasis regarding this. Fundamental principle, load and motion. Load and motion. In, see load, dumbbell, working. And I'm playing panja with my patient, young girl. I'm playing panja, one boy or girl, boy. So this is in different, you see, elbow, wrist, radius ulna, shoulder, hand, elbow, everywhere you can put Ilizarov. Nothing to be worried. Again, in the femur, how beautifully she is. If your biomechanics and fixation is stable, don't need, see, cumbersome. Everybody is telling cumbersome in the femur. What kind of cumbersome? Here, she is walking, the hand, and achondroplastic patient. These are the, this is in the femur, this is in the femur, this is in the tibia and femur, see? And this is beautifully walking, see, left. This is cosmetic lengthening of student of Dhaka University. I have done the cosmetic lengthening, 6 centimeter lengthening of both legs. This is Ilizarov apparatus in the right femur. And this is the ankle. And this is the ankle. If your fixator is stable, biomechanically, patient will not feel any discomfort. And I am also showing this. See the femur, laddering, jumping up. See the fixation. See here, offering with the oblique support. He is doing exercises with femur, non-union of the femur. You must instruct all the time. Physiotherapy is from their side and giving instruction what to do, and he's doing the exercises. So, and finally, stability or Ilizarov compression, destruction, construct. Biomechanics, Ilizarov fixer plays a very important role in healing process. This is very important. Ilizarov gives the advantage of Ohm's law. According to Julius Ohm's law, bone adapts to its mechanical environment. The primary factor in the stability of Ilizarov fixer is the elastic tension wires. Ilizarov wires should be positioned in consideration of application forces in all planes with proper leverage, and that is obtained by wire across wide angles. Multiplanar diverging half-pin configuration is the stiffer than a tension transosseous wire. They have done a scientific work, and Professor Shepsov and al. They are telling like this. So now why Ilizarov? I always tell the advantage of Ilizarov. See, Ilizarov compression distraction device provides flexibility and adaptability. Ilizarov serves 4 purposes. What are the 4 purposes? I always also repeatedly mention, number 1, it gives a stability, strong stability mechanical. Number 2, when you are giving stability and at the same time you are going for compression or distraction, you are getting billions of cells around the line of compression or distraction. Number 3, you are increasing circulation 330%. And number 4, you are not disturbing any kind of periosteum, endosteum or anything, rather you are increasing. That means you are getting good result, good healing process. And Ilizarov fixator, this is modular, customizable. This is so important. It can treat multi-level, multiplanar, and multi-directional deformity. Can articulate across the joints. And only one disadvantage is starting from your residency till death, you should have to learn and learn and learn, study and study. That is called greater learning curve. No, infinite, limitless. This, everything is limitless. Ilizarov method is not hard to learn, but it does take, what take? Proper knowledge, study, effort, devotion, patience, practice, and intelligent, meticulous follow-up from time to time. If you really want to do justice to your patients, or for all, poor, middle class, or rich, with different varieties of diseases, you should opt for it. This is the my teaching all the time. I tell the why Ilizarov reasons, main reasons behind the complications of the Ilizarov technique during treatment. Why? Because number one, inadequate knowledge, improper technique, that is the violation of the original Russian Ilizarov principles, and lack of skill, lack of intelligent, meticulous follow-up, lack of patience, and of course, in everywhere, hybridization. This is the main thing that you are going for failure of the Ilizarov. And I always show this one repeatedly so that you don't forget. You must follow that one. While you are putting Ilizarov apparatus or carrying apparatus in the thigh, please do this kind of trolley and bed for the Ilizarov patients. Otherwise, you are not treating the patient, you are giving discomfort to your patient. Okay. And in my conclusion, dear friends, I'd like to tell you the things, stability of the Ilizarov fixation. How many things here? 7 things are needed that I told you everything. 7 extensive factors and 5 intensive factors. These are 2 biomechanical factors, gives scientific basis for intelligent use of Ilizarov fixator. These are the, I told you earlier, this is the rings, wires, diameter, and olives, everything, olive wires, number of wires, position of the center of rings to fracture non-union site, and of course the intrinsic factors. What are the intrinsic factors? You can see area of tissue contact between bone ends, modulus of elasticity of tissue between bone ends, length of gap between bone ends, mechanical configuration between bone ends, tension of soft tissue surrounding bones. And this one, biological principles that was taught by Professor Ilizarov, produces a mixture of good biology, dear friends, with good biomechanics that leads to excellent result. This is the beauty of biomechanics of the Ilizarov. And this is my professor, my mentor, his house, 10 kilometers from Kurgan. This is, see, I visited his house 3 times or 4 times. This is Professor Ilizarov's house, Shevtsov's house, Professor Shevtsov's wife. You know, last time L22 came, pediatric orthopedic, in our conference in Dhaka, wife of L22, that means Professor Shevtsov's daughter. She's the head of the polyclinic, daughter's daughter. And this is my son, Dr. Shayad, Professor Shevtsov's house. And this is, you know, already I have made this in my center. These are, you have seen biomechanics of Ilizarov. This is biomechanics. This is biomechanics. This is biomechanics. This is, you know, butterfly. The Ilizarov apparatus, innovative as much as creative. This is from Ilizarov Museum. And when in 2003, I was in Kurgan. This is my room. I was staying, studying, and Professor Shevtsov came to my room on that day to see me. 2003, it was in, see, 2003, so young. Professor Ilizarov, Shevtsov, sorry. And probably you have seen, he is the friend of Professor Shestakov, 83 years now running. It was in 2012. And Niretin, he came to Dhaka in 2000 with Gubin, he came. He is a ankle and foot surgeon, very good ankle and foot surgeon. And he's also ankle and foot surgeon. And then I was working in the hip pathology. Edward, you have seen in Operation Theatre 2012, hip pathology. I was working there, see. And in the Department 9, Tropine, very Professor Tropine, they are doing adult of hip, knee pathology, this one. The other staffs of the, this is Tropine, 2006, it was in 2006. Now, Shestakov and I myself, during foot surgery, 2012. These are some glimpses of the Ilizarov Center. And this is, I always see, when I see, I become nostalgic all the time. You have seen the drills they are using, very good quality of drills, and they are removing just the drill from the wires. So this is, we are doing the foot surgery of rocker bottom foot. Probably, I think so. We have done that day 3 cases. So, and I'll see, this is Professor Shevtsov and I myself. We are going to his house. He has come to my place. My teacher, my mentor, I learned a lot of things all the time. When I was Kurgan, I spent a lot of times with him. And see? No. I am talking with him regarding the Quran. This is our all fellows. Recent picture. This is also, see, I also show this case. This is from the graveyard of Professor Ilizarov. Great scientist, talented doctor, gifted innovator. Scientist, doctor, gifted innovator, creator of the apparatus, method of methodology, and academician. Academician, that is a great thing. In Kurgan, Professor Ilizarov and Professor Shevtsov are the academician. A professor, that is another thing. Academician, very, very big thing. You cannot imagine what is academician. And this is also, you must play with the Ilizarov patients. My Nigerian friends, you can see Emba is there. Emba Iobinna. These are the special cots that patient can do the exercises. And the cot you see here with the space in the bed. And these are my publication books. And this is, I always remember all these things. Thank you. So if you want to learn something, regarding the Ilizarov, you must have in your life the discipline, way of thinking, rigorous approach, truthfulness, sincerity, devotion, dedication, and honesty. Then will, of course, all these things of my life given me the academic career. And I try to follow all these things. Thank you so much for your patience hearing.
Thank you, sir. Can you please stop the screen share, sir? And I am totally speechless. Usually, Barisal lecture is a complete package where you can get the history, you can get the proper knowledge, you can get the science, the philosophy, and also the art of living and the art of delivery of service to the patient. So I think it's a complete package for enjoying the lecture and enjoying the his speech. He is always a very brilliant speaker, and I just congratulate you, sir, for your nice presentation. And we always eager to learn from you, to hear from you, and always want you as a teacher. Sir, you can stop the screen share, the red icon on your desktop, maybe in the upper part, lower part, so that we can go to the participant mode.
I don't see. This is already gone.
Maybe in the top and maybe in the down.
Oh, shop. Okay, okay. Okay.
Okay, sir.
Okay, thank you.
Okay, thank you very much.
Yes, sir. There's lots of people. They're just
How many people?
Total 26, and one is joining.
Oh, it's good.
And now it is time to interact with Bari sir and have a question. There are few questions in the chat box. And before going
How
to the,
many?
sorry,
How
sir.
many? How many questions?
Sir, there are already 7 questions, sir, and
Okay.
some question is already to me in WhatsApp, sir. Sir, now I am going to Amir Hussain, sir, for a brief commentary regarding the whole of the session of Bari, sir. And after that, we may go to some of our foreign friends participants for short comment regarding the whole session. And in this time, I will organize the question answer session and pick up all the question from the participant. I am going to Amir Hussain, sir. Amir Hussain, sir. Amir Hussain, sir, please unmute yourself. Amir Hussain, sir, unmute yourself so that we can hear you.
Yes, yes.
Yes, sir.
Thank you, Bari sir. Thanks a lot, and thank you also, Dr. Arif. And I am nothing to say as because Bari Bhai is the master of this subject, and his lecture delivered is very nice and very knowledgeable also, and also for the newer generation or newer Ilizarov surgeons. This lecture is very much fruitful, and Bari sir always say that load and motion is the vital point for the Ilizarov. And if after applying Ilizarov, you stand still, or you had no motion or movement, Ilizarov will not work properly. So load and motion is the vital, and also tension of the Ilizarov wire is vital for me, as because when there is a loosening of the wire, there is a lot of complication like pin-tack infection, and also infection, and also non-union also. Thank you. Thanks a lot to Bari Bhai.
Thank you, sir, for your nice words. And at the some point of the today's presentation, we feel that Bari sir get some sorts of emotional attachment with the presentation, and also he has the all emotional things with related to the Kurgan. And you know that we have already completed 22 lecture, and there are just 2 days left for ending this basic session. So all the Kurgan fellows, including the Bari sir, is getting emotional, because for the last 1 month we are very much involved with these academic purposes, and every day we spend very lot of times in this session. And so far I calculated that Bari sir non-stoply give us around 50 hours with this session. And it is very much we are very much fortunate that Bari sir managed this type of time for us, and always continuously he was the part of this session. And now I am going to some of the foreign participants for short comments on the session, and after that we will go directly to the question answer session. And Dr. Indranil, Datta, if you can hear me, I think you are from India. I tried a different time to connect with you. If you are in online, you can pass some comments regarding the session. Dr. Indranil sir, Dr. Indranil Datta, can you hear me, sir? Sorry, sir, we cannot get connected with Indranil sir. Now I am going to Adekunle sir. Please have your overall short comments about today's session. Adekunle sir, you are always with us.
Yeah, good morning. I have written something on the chat page. Professor
Yes,
Bari,
sir. Yes, sir. I will go the question just a few
yeah,
minutes later.
it's a blessing to those of us that have not been able to meet Professor Ilizarov. He's unique, he's calm, he's ready to impact knowledge. In fact, this is another Ilizarov. So I think Bangladesh is very lucky to have a man like him. He's ready to teach and ready to impact knowledge. I'm always looking forward to his talk. You know, he's making Ilizarov as simple as ABC. And I love your words. What you need to do is to keep reading, just like you said, keep reading, keep practicing. In fact, thank you very much. I really enjoyed this. I have sent a question to Dr. Arif, and I'm sure he will read it so that you can answer that. Thank you very much.
Okay. Arif, Richard Omoyeni, Richard Omoyeni, he's willing to talk.
Omoyeni is from Nigeria. He's my friend, Professor Bari.
He's from Nigeria?
Yes, he's my friend.
Your friend, but he
at University College Hospital in Ibadan.
Oh.
Yes. Hello, good morning or good afternoon. It's afternoon here in Nigeria.
Yeah.
Okay.
So thank you for the lecture. I missed the early part of the presentation because I was engaged in one activity, but the little I met was a very good eye-opener to me, just like the previous lecture you have given on this platform. And I want to thank you for being there for us and showing us some of your works. And we have a lot of for Ilizarov in Nigeria, but we realize that we still have a lot to learn. We have a lot to learn from you to tackle some of those complex cases. And we can only wish you sound health to continue to impact our generation with your knowledge. So I look forward to more lectures from you, and maybe someday we have the opportunity of coming to learn at your feet. Thank you so much.
Thank you, sir, for your nice words. And always with our session, we have the Dr. PRS sir, and PRS sir, if you are in online and if you can connect with us and have some comments. So that after that we will go to the question answer session. PRS sir.
Am I audible?
Yes, sir. You are audible, sir.
As usual, it was a very nice and lucid presentation by Dr. Bari sir, and we are lucky enough to be a part of this 1 month long training and online webinar. And it's really very fortunate to have. I mean, Bangladesh and you, surgeons from Bangladesh, are really fortunate to have a mentor and a teacher like Dr. Bari. And we really hope and we wish him a good health so that he can teach us more and more. And someday probably we can meet him and learn him from him if that is possible in future. So it was really nice being a part of this. Thank you very much.
Thank you, sir, for your nice words, and I welcome you to Bangladesh also. And for information of everybody, you know that this program will be uploaded shortly just after the program in our YouTube channel, Ilizarov Clinic KUMC, and also in Ortho World, and it is live streaming on YouTube channel of Ortho World and Ortho TV Live, and also it is a very good sign of very good collaboration between the Indian and Bangladeshi orthopedic surgeon. So I just express my gratitude to Samsuluddha sir and Ortho TV Live authorities for doing this thing very organizedly every day. And you know that getting time every day for 2 hours or 3 hours, 2 hours or 1.5 hours is very difficult. But Samsuluddha sir and Ashok Sam sir, all the authorities of Ortho TV Live, they are doing this job for us. So now the time for question answer session. Bari sir, I am going to my chat box so that we can have the question. And if you have any question, you can send it to me in chat box or just put your hands up and I can connect with you. And otherwise, please mute your microphone so that we can go clearly in the question answer session. Sir, first question to you from Mainuddin Mazumdar sir. Sir, am I audible to you, sir?
Yes, yes.
Yes, sir. So first question from Mainuddin Mazumdar, titanium wire versus stainless steel wire. What is your comments?
That means 1.5, 1.8 or 2 mm?
No, sir. Titanium wire or stainless steel wire. Normal Ilizarov wire or SS wire or titanium wire. Which is better, and is there any superiority of on another in comparison?
You know, you have seen in the Kurgan, they are using not that they are using what type of wire? You have seen that one?
Sir, we have seen
Right.
all the stainless steel wire, sir.
Stainless steel wires. Good. Stainless steel. We are using stainless steel wire.
Sir,
No,
if you
Titanium. Titanium wire he is getting where? Mainuddin?
sir. Yes, sir. I did sir two cases by titanium wire, but I think the titanium wire is soft and early to breakage.
1.5. 1.5, 1.8.
2, sir.
Huh? 2.
2 millimeters, sir.
2 mm. Yes, you can use that one. I am using, you know, the Kurgan wire, even olive and smooth wire. 1.5, 1.8, 1.2 mm. You can use that one. But the elasticity of the wire that we are using from the Kurgan is good in comparison to the K wire.
Sir, with your permission, yes, sir. You can.
I have another question, sir.
Yes, sir.
Sir, you said that good biology with good biomechanics, but we did Ilizarov with bad biology. we did by Ilizarov cases are usually with very bad biology.
What do you mean by good biology? What do you mean I that? What do you mean that one? Good biology? Only a simple case? No. If you maintain the biology, that means if you respect the tissue that was damaged, that is another thing. You must respect. Good biology, it doesn't mean that you don't have any injury. No. That means you must respect the good biology, respect the soft tissue. I mean that. Not that the no injury, simple case. No.
Oh, yeah. Thank you.
You understand? Okay.
Sir, with your permission, I want to add something regarding the wires. For Mainuddin Mazumdar, the titanium wire, the manufacturing and utility in orthopedics area usually not a very big history. It's comes a little bit a few years ago for titanium wires, but in Ilizarov Center we asked them about what would be the best materials for Ilizarov frame. Their answer was that stainless steel wire or medical grade steel is the best materials for the Ilizarov technique. You know that in Ilizarov system there is when a micromotion, Barisa told us that you allow only the micromotion of 1 millimeter. This micromotion cause production of the piezoelectric force. This piezoelectricity have the specific conductivity and also their formation of circuit in your ring frame system, and it increase your biological activity of the bones and osteogenesis. To get this advantage of piezoelectricity and micromotion, you need to adhere with the time trusted technology. And I think that many time we will get many times or many time left for titanium wires for showing its very good utility in orthopedic surgery. And also we have a very good number of patients or meta-analysis and other things. We can switch over to titanium wires. And other thing is that titanium wires is also a very costly one. So our advice is that from Kurgan Center, usually do not hybrid. Bari sir always says that do not hybridization, not with the even the shunt spin, even with the different materials of frame assembly, like use the combination of aluminum, combination of SS, combination of titanium. These different sorts of metal can also cause the different biomechanical problems and also the chemical problems within the body circuit. When a Ilizarov SS frame produce this type of restricted circuit in the your limb or any frame construct. So I think we can discuss this thing in a very large scale, and day by day the more and more research articles will came out about the titanium wires and versus stainless steel wire, so we can make a conclusion afterwards. So now I am going to another question to Bari sir. Adekunle sir question, how do you use bent wire, that is the bent wire, for interfragmentary compression? I think the Adekunle sir, the bent wire, I think, yes sir.
I've already showed that one.
Yes sir, you already showed that. So I advise to Adekunle sir, please go to the lecture another time in the YouTube and
try
you
to
can
listen
show
that one. Yes.
how olives or a bent wire can cause the interfragmentary compression, or even if you just put a wire in a bending manner to translate the bones from one place to another place and put traction in it, you can do this. So if you go through the lecture, you can have this answer. And now I am going to another question. Oh, sir, the same question regarding the bent wire. Do you bend the wire before applying the bent after? Technique is not clear to me. I think to Adekunle sir, you can WhatsApp your question, and if we can, we will answer you, because this bending usually by putting the wire in a superior hole from the as usual hole where is exit and entry, and usually in this manner this wire is bented. And there are different other techniques of bending wire and other different clinical scenarios. You can get all these things if you connect with us. Now another gettings from the Adekunle sir. Okay, it is to everyone, and already Adekunle sir just stated this in front of us. So there is a question in my WhatsApp: what is the consideration of Ilizarov fixation in osteoporotic bones, sir?
Oh, a very good question. No obstacle. Osteoporotic bone, you can easily, in osteoporotic bone, I am using most of the time olives.
Osteoporotic bone, sir. Yes, sir.
What is the property of the bone? The man who has asked the questions?
Sir, Rashid Hassan Rani, sir.
Rashid Hassan, I would like to ask the question, what is the properties of the bone? Let him answer.
I'm seeing. Sir, I think he's just got on offline, and oh, Rashid Hassan Rani, he's here.
What is the properties of the bone?
Rashid Hassan Rani, can you hear me? Rashid Hassan Rani.
When my fellows come to fellows come to my center for fellowship, I put 13 questions, printed questions.
Yes, sir.
First, what is the properties of the bone? Most of the orthopedic surgeons, they write the function of the bone. Properties of bone quite different. Mainuddin.
Yes, sir.
Don't take it otherwise. You tell me what is the properties of the bone.
Sir, osteoporotic bones or normal bones, sir?
Any normal bone, what is the properties? Same properties with the osteoporotic bone. 3, hydrostatic, isoelastic, and pneumatic. These are the properties of the bones. Hydrostatic, isoelastic, and pneumatic. Isoelastic, you kept transosseous. This is Ilizarov. Transosseous wires you put through the bones. This is correlates with the properties of the bone. Wire and flexibility, bone flexible, isoelastic. This is the properties of the bone. Function, there is another thing. Osteoporotic bone, no obstacles, rather it increases circulation. Drilling the bone, you're increasing circulation. One law of tension and stress, slow and steady traction, only living tissue creates a stress which is metabolically activated. That is the Ilizarov law.
So what are the
Don't forget.
Where in osteoporotic bones, sir?
Huh?
Why you use olive oil in osteoporotic bones, sir?
Because when you keep the bone to smooth wire in the osteoporotic bone, 2 months or 3 months, 4 months, it makes the bone hole bigger. If you put the olive, it will not move, you know. That is the reason I use olive in case of osteoporotic bone. And not only olive, combination both. Olive and wire. Smooth wire and olive.
I have a question regarding this. Sir, what is your recommendation regarding drilling in osteoporotic bones? Should we drill it as usual manner or we can hammer it through the bones?
It depends. Some osteoporotic bone you need to go for drilling. Some you can hammer. Only wire tension. Hanging bridge. Ilizarov apparatus just like a hanging bridge. Say, do it? No.
Sir, with this contest, I want to add one more things, if you permit me.
Yes, sir. Go talk.
Yes,
no problem.
sir. For Moinuddin sir, and in osteoporotic bones, it is a very good choice for adding the olive. And also, I asked this question to one of the professor, senior professor in Kurgan Center, Shigirov sir. What will be the consideration of the wire or the wire orientation in osteoporotic bones? The sir answered me that you have to use the divergent wire in a different plane and different direction in osteoporotic bone for increasing the purchase area in the bones, so that you can have a good stability in the ring. Because in osteoporotic bones is is very porous, every wire is loosened very easily. If you put wire in different plane and in oblique manner and in different direction and a little bit 1 or 2 hours in another plane, it will increase your holding capacity. And another thing is that, sir, this is a question from me to you. Do you suggest to put any shunt spin in osteoporotic bones, sir?
See, this is the fighting with me to other Western world. I always tell them, why you are putting shunts in tibia or anywhere, normal tibia, let us stop for the osteoporotic. You are putting shunts and then wires and telling I'm doing Ilizarov. This is not this is the principle. This is not the principle of Ilizarov. You are putting a lot of shunts in the tibia and telling I'm doing Ilizarov. You're doing hybrid. This is not Ilizarov. This is you're doing a hybrid. That's why I always tell them you're violating the principle. Once you are violating the principle, you can do that. That is your job. But I must maintain, I must respect the principle of the Ilizarov. Micromotion. Rigidity, I told you, rigidity and stability, this is not the AO group also telling now, no rigidity. Before that, they are told rigidity is not the stability. Undesirable rigidity, we cannot. In Ilizarov fixator, in the tibia, okay. All the time you put the wires, transosseous. The system is called transosseous. And in the femur, proximal, you can put that one, no problem. Our osteoporotic bone, it depends on, sometimes it depends on your location of the operative area where you are doing. Even then, small area you can put the wires. Small, very small area you can put the wires. Nothing to lose with the wires. It is bound by very austerity. You go for zoledronic acid. You go for other calcium and other things. That will help you, no problem.
Yes, sir. Thank you, sir. Mainuddin sir, for nice interaction. Sir, there is a question from one of our Kurgan fellow. Sir, we saw a stainless steel ring in Kurgan, but there are carbon ring. Which is good to view X-ray, and what are the rationale of using the carbon ring?
The answer is using carbon ring for surgeon is good, for patient is bad. Because I have used also carbon ring for comparative study. Whenever you using carbon ring, you must use washer all the time.
Yes,
all
sir.
the time you should have to use washer. And within a short time, you are damaging this washer and everything. What is the difference between carbon ring and Ilizarov ring? This is just like a hanging bridge. Even if you're using stainless steel, it doesn't harm anything. It doesn't too much weight. What is the use of carbon ring? You see, tell me.
But actually, you
Only one utilization. Whenever you see the carbon ring two types, radiolucent, non-radiolucent. You can see the X-ray everything. Even if you are using this stainless steel in 3 dimensions, you can easily find out in the C-arm whether your callus is going on or not. These are the previous talks for seeing the X-ray. We are using carbon rings. So carbon rings, this is money business, nothing else.
Thank you, sir. And usually, Bari sir every time told us that you have to do a oblique view. Don't always go for the AP and lateral view for taking your decision regarding the union consolidation. Sometimes for
Always dismounting, before dismounting, 3 cortices, okay, remove 3 cortices.
Yes, sir. And also you can consider to put the rods. If it block your X-ray view, you can just readjust it to see the fracture configuration very well. So,
dear friends, what I am telling to you, it is not that I am a big man. No, this is from my teaching, from my Kurgan center, from my long years experience that I am giving you for your smooth life. So that I am doing everything. I am telling you confidently, with 100% confidence. I do the Ilizarov, and I always working everywhere, not only here in my country, all over the world. All over the world. Because I know what is Ilizarov Center. Why? Because I speak Russian better than English.
Yes, sir.
That's why ins and outs, everything I know. The Western people, they know that Dr. Bari knows the Russian. That is my advantage.
Yes,
What is happening there. These 7 gentle boys, they have seen. Western world always talking about everything against Russia. Oh, Joe, ask them. They are not nostalgic. They are not telling all the time we are so. No. That Munir, he was in UK. You asked him. He was working in Birmingham. You asked him the Kurgan Center. He can differentiate.
Yes, sir.
Okay, Dr. Munir, do you want to
Tell him.
comments about this?
Yes, sir. Kurgan Center is exceptionally. It is. I worked in Royal Orthopedic Hospital in Birmingham, but they are not arranged like the Kurgan Center.
So, Mainuddin, once in a life, go do Hajj there.
Mainuddin is very much interested to go there.
Always ready, sir.
Your life will be changed, I tell you.
Sir,
Once
now I am
Now
going to Nazmullah Setu sir for last few minutes that Nazmullah Setu raises his hand for he has some question. and directly to the our speaker. Nazmullah Shetty sir.
They are all the time nostalgic. They wants to go. If they
Nazmullah
could
Shetty
go
sir.
there in young age, they could marry there. These all.
Nazmullah Shetty sir, do you have any questions,
Yes.
sir? Yes, sir.
Yes. So, sir, actually, I have no question about the lecture. There is excellent lecture, and I always enjoy this type of lecture. And our great sir always give the excellent lecture. Previously, we also enjoyed, and today is also excellent and outstanding presentation. And our Kurgan Center, that is now we easily call it our Kurgan Center, and we always nostalgic about the Kurgan Center, and we enjoyed the time very much. That means we are just like at home at Portsmouth. So when we see the Kurgan pictures and Kurgan Center's pictures, and when we see the Kurgan operations, then we become very nostalgic, and we always eager to go again to that center. And if we hope that we will go again to that center after the Corona situation, we are ready to go there. And thank you, Arif. Very good discussion over there, and I also enjoyed the discussion. Thank you, Arif.
Thank you, sir, for your nice thoughts.
If you go without me, I will kill you.
No.
It is one line and it is recorded. Mainuddin bhai, be careful. And for your information, I want to deliver you that the Kurgan Fellow Group just planned to materialize this webinar just in a printed form. And after the end of this session on the 24th, we'll work on the printing version of this webinar. So you can get all the things in printed version. And I think it is a good form of communications between the juniors and all the colleagues who are interested in Ilizarov technique. And now we are coming to the end of the webinar session. I am going sequentially to some of the co-hosts, and then we will go for Samsuludha sir. You know that Samsuludha sir is usually very busy in his clinical practice in this time of the day. So if he is online and I can connect with him and have comments about the session. After that, before going to Samsuludha sir, I want to go to the Abdullah, the co-host, and the Ghulam Mustafa, and then go to and we already have the Nazmullah Shetty sir, and then go to the Bari sir for concluding comments, and go to Samsuludha sir. So everyone be prepared for this sequence. I am going to Abdullah. Abdullah, I have your comments. If you have any question, you can add, and also your impressions. Yes, sir. Abdullah sir,
thank you, Dr. Arif. Can you hear me?
Yes, sir. We can hear you, sir.
Okay. Thank you, Dr. Arif. It is very difficult for me to comment about Bari sir lecture. It is our great opportunity to gain knowledge from our mentor. A to Z of this lecture is tremendous, marvelous, miraculous for us.
Okay.
Criticize karo, kichu improve korte pare. You criticize me, then it will be better. I want to criticism.
Thank you, sir. Thank you to all participants, home and abroad.
Yes, I'm Abdullah, sir, for your nice words. And now I am going to Mustafa. Mustafa, can you hear me? Mustafa?
Mainuddin is willing to tell something. Mainuddin.
Sir, Moinuddin sir is one of the most active participant today. So after Ghulam Mustafa, I will come to Moinuddin sir.
He is good. Moinuddin is very good.
Ghulam Mustafa sir, can you hear me?
Yes, I can hear you. Can you?
But we cannot see you.
Okay, there is some problem. Assalamu alaikum. Thank you all participants. Special thanks to my mentor, Professor Bari sir. We are really grateful to you, sir.
Yes, sir.
You gave us time from your busy schedule, and today's lecture is one of the best lecture I have ever seen. And we are very much fortunate because you are one of the greatest Ilizarov surgeon in the world, especially the subcontinent, and we are always in touch and blessed by you. We are really fortunate. Thank you, sir, for your nice and elaborate lecture.
Thank you, Ghulam Mustafa. Please stay connected. And there is an announcement for all that tomorrow we will come back same time, same session with another views of biomechanics of Ilizarov by our Kamruzzaman sir from Mymensingh and one of our very potent Kurgan fellow. And if you learn from the different speaker or different faculty, then you can pick up some new things, even some more interesting things. So we believe in diversity, and we believe in the vibrancy of the Ilizarov technique. So tomorrow our lecture will be given by Dr. Kamruzzaman, the biomechanics part 2, same time, same session. And now I am going to Mainuddin sir, have a concluding comments and short comments, sir. Please unmute. Yes, sir. Mainuddin sir.
Strong, sir. Actually, this is the very beautiful lecture I ever seen, especially if our country presentation without graphical presentation. But its lectures are at some graphical presentation, which makes it more beautiful, more enjoyable, and more elaborate. Thank you very much, sir. We are very much fortunate to have you, sir. Thank you, sir.
Thank you, sir, for a nice. And usually this type of graphics and animations and some sketching, it needs very much hard effort to get this. So Bari sir worked very hard for this type of presentation for us, and especially thanks goes to Bari sir for making the nice presentation and nice slides. Now I am going to Samsuluddha sir. If Samsuluddha sir can hear me, yes sir, we cannot see you, sir. Okay, sir.
Hello.
Sir, you are OT, I think.
Yeah, I'm in OT right now.
So you're getting a lot of patients every day, eh?
Sir, we cannot skip emergency cases right now, sir.
Oh.
Okay, sir. I think you will always with us, and also if you miss any part of the session, you can go to our recorded version. And
sure, I see all the recording at the night.
Please make your comments overall session, and I am delivering the host status to you. Sorry, sir. Before that, I will go for Bari sir for some comments, and then we will. I am delivering the host status to you, and have your comments, sir. Please.
Thanks a lot, Bari sir. Thanks to Corona and lockdown, we just got chance to learn a lot from Bari sir in this period. Yeah, it was a wonderful lecture. I'm very sorry I could not listen to the whole lecture because of surgery. I'll see all the videos at the night. Please, Bari sir, for your concluding comments, sir.
Yes, sir. Bari sir, please concluding comments.
I was the presenter. I have nothing to say. I cannot say that I have delivered a very good lecture. you the people, you are the main, I have learned a lot of things from always, from my junior colleagues, from everywhere. Yes, this is my motto. Even body shake, how he speaks, how he's talking with other. I always try to learn, follow everyone, you know. This is my motto. I want to learn from my mistakes and from my junior colleagues. Senior is okay, but junior colleagues learn a lot of things. They know something better than me. That's why always when you are here, I feel proud myself that my junior colleagues are here. I can teach, and at the same time I can learn something from them. How they are speaking, how they are shaking their body. These are my always intention. That today I'll see the new faces. Thank you very much. You love Ilizarov. My only one thing always, love the Ilizarov. Then you'll be able to do anything, and you'll be very good orthopedic Ilizarov surgeon. Okay, thank you very much.
Thank you, sir, for your nice comments. Usually our webinar platform is very much unconventional one. Every day you see that there is no this type of guest or a panel of expert. Every participant have the free access to the speaker, and everyone can ask question, even can speak in this session. This is a very much interactive session. Everyone have the right to communicate. So we do not go in a conventional form, and every time we hear from the Bari sir frequently and by many times, so that we can get more things from him. And now I'm going to Samsuludha sir. You can stop the live streaming, and I already delivered the host status to you.
Thank you, Dr. Arif. With this, thanks from Ortho TV side, thanks from Ashok Sam side. With this, I'm stopping the live stream.
Thank you, sir. Tomorrow the same